Hello, myself Dr. Hemant Bhavnerkar. I am a Mumbai-based oral and maxillofacial surgeon. Today, I am going to inform you some short procedure of management in facial space infection. I have already covered the detailed video on a facial space infection and management with Ludwig's angina treatment. Today I am going to do a simple procedure of incision and drainage which you can do in your dental clinic also. As we know that any abscess, facial space infection and abscess is mostly caused by a dental source of infection like long-standing chronic dental caries tooth or the tooth with associated with the periapical infections. In such a cases, the infection of mandibular jaw or maxillary jaw comes to the buccal space, then subsequently goes to the submental, submandibular, and pterygomacetic space. Sometimes it involves bilaterally and forms a Ludwig's angina. Let's see, in such cases, we need to do a incision and drainage. Let's see what is the procedure of incision drainage. Generally, incision we put according to the location of the pus, and the incision must be made over the most dependent part or the fluctuant area or the over the most direct root of the pus. So after the incision, the pus is directly come with the flow toward the gravity and downwards. The resist the temptation to always incise over the thinnest point of the abscess. So this area could be a ischemic and the incision can be lead to the necrosis, unsanguinely seeing the scar over the face. So that's why we have to take care over in such a condition. Incision must be large enough to permit the pus to come out, and the aesthetic problem after the incision drainage should we do not encounter. Then the location of the incision on the skin is also guided by the direction of the largest lines of the Langer's line and the placement in the aesthetic acceptable area such as with the shadow of the mandible. So we have to always plan the incision drainage whenever we do the extraoral incision drainage. Here I am talking about the submental and submandibular space infection management with the incision and drainage. Let us see on the few cases and the exact area of the incision and drainage. Here the on the image, first image, we can see the submandibular incision side just below the two finger beneath the mandibular inferior border. Place the incision on the most dependent part as I said earlier. If the incision is placed on the prominent part, place the contour incision on the dependent part. Then the liberal, dependent and passive drainage should be achieved. Then use of sinus forces or index finger to break the loculi inside forming the abscess. So all the pus should come out. Then the break the all locules to change the multilocular cavity into a unilocular cavity. So a secondary accumulation of pus should be avoided. Then whenever possible in large space infection cases, we should put a drain, rubber drain, so the continuous flow of the pus, if any, is maintained, and ultimately we will achieve the completed drainage of the pus. Then the whatever pus we received, we should send to the culture and sensitivity test so we can identify the exact antibiotic which can give the patients for the infection management. So that antibiotic will helps to cover the infection fast, and the patient should the infection should not spread in the lower dangerous spaces of the infection. Okay, so here in first images and second images, the submandibular incision is placed and the locules are braked with the help of forceps. In this case, the patient, a young patient, received to us with the submandibular space infection. Intraoral extraction of the teeth are done. Extraoral submandibular incision placed just below the angle of mandible, and the intraorally forceps placed in the locule are break. After the immediate incision placement, we can able to see the pus it's starting coming out. After the pus is starting coming out, we have to press extra orally just above the our incision line, so the all the we can take out the all pus inside the locule form in the abscess cavity. Sometimes multilocular abscess cavity we have to drain and cut the intraoral intra abscess locule and form the unilocular. Here rubber drain is also placed. In these images, these patients having a large buccal and submandibular space infection received to us after the incision drainage. Almost 300 ml of pus is we have drained out. The patient have multiple systemic diseases also. That's why it's become a large. This is the final outcome. Thank you.